Mama Osato, remember one of my earlier videos, I promised I was going to share with you reasons why your vaginal infection keeps coming back even after medication. Well, in this video, I'm going to be outlining reasons why this keeps happening. You want to stay till the end. Hi guys, welcome back to my YouTube channel. To my old subscribers, I want to say thank you for sticking with me till this point, and to my new subscribers, welcome to Diary of a Niger Scientist. Happy Easter guys, hope you're enjoying the holidays because I am. Remember to like, share, comment and subscribe. Before I outline the reasons behind your recurrent infection, what is a recurrent vaginal infection? A recurrent vaginal infection is an infection that occurs or comes back after completion of your medication. A yeast infection is considered recurrent when you have experienced 3 to 5 episodes in a space of 6 months. Now, if between January and March you've treated a yeast infection more than 3 times, it is safe to say that you're experiencing a recurrence. Mama Osato, one of the reasons is antibiotic use. Catarrh, you take antibiotics. Cough, you take antibiotics. You treat typhoid every 2 weeks. Do you know that these antibiotics you're taking is having an adverse effect on your vaginal health? Remember I told you, in your vagina, there's the good microorganism and the bad microorganism. The good microorganisms are there to keep you moist, healthy and safe. When you continually take antibiotics, when you abuse antibiotics, what this is doing is it is killing the good bacteria present in your body, thereby allowing the growth of Candida. Another reason is non-compliance to treatment regimen. What this means is, Mama Osato, they will give you drug and tell you, take this drug for 5 days, take this drug for 7 days. But you say no. Once you notice that your symptoms have disappeared by the 3rd day, your vagina has stopped itching you, you stop taking the drug. Don't you know that microorganisms, they have sense? Don't you know that Candida has sense? It is a living organism. Just as humans have life stages, so also does these organisms have life cycle. So for every time you do not complete this drug, these microorganisms get stronger by the day. This leads me to my 3rd reason, which is antifungal resistance. Just as we have antibiotics resistance, so also we have antifungal resistance, and this comes up when you do not complete your treatment regimen. Just imagine you keep on taking antifungal drug halfway. Over time, Candida becomes smart and becomes resistant to these antifungal drugs. Another reason is humidity and moisture. Now you will agree with me that our vagina is a humid and moist environment, and Candida thrives in a moist and humid environment. Mama Osato, only you will wear pants, you will wear tights, you wear jeans, you bomb shorts, you now wear skirts under. Allow your vagina to breathe. She's a living organism. For every time you wear a tight-fitted panties or undies or cloth, you're creating a very humid and moist environment for this Candida to grow. Another reason under this is, Madam, Mama Osato, you will not dry your panties under sunlight. You will not allow your panties to dry properly. Don't you know that your bathroom is a moist and humid environment? So even when you get to dry your panties in the bathroom, it still preserves or it still traps moisture in your panties. Now, Mama Osato, another reason is wrong vaginal hygiene. Osato, only you will use Femcare. You will use Fem this, Fem that, Fem those, Fem whatever, just because you want to smell nice, you want to taste nice, you want to flow like the rivers of Babylon. Osato, don't you know that all these products contains artificial chemicals, artificial products that can over time remove or reduce the population of the good bacteria, thereby allowing the growth of Candida? Another reason could be using sanitary products for a long period of time. Osato, how can you use one pad for 8 hours? How can you use one pad for 8 hours and you are wondering why your infection is coming back? Osato, using one pad for a long period of time traps moisture in your vagina. When you repeat this process over time, it encourages and it provides a very good breeding ground for Candida. Another bad practice, another wrong practice is wiping your private from the back to the front. Osato, no. This is 2024. You cannot keep on wiping your vagina from the back to the front. That is a very wrong practice. Mama Osato, as I said in my earlier video, sexual activity could be the cause of your recurrent infection. Remember I told you, if Papa Osato has oral thrush, there's every tendency of him transferring candida from his mouth to your vagina. And secondly, if after the onset of this candida infection you get treated and Papa Osato remains untreated, every time both of you have unprotected sex, there's every tendency of him transferring this organism from him to you. Now remember, candida is not classified as a sexually transmitted infection because women can still have candidiasis even in the absence of sexual activity. Another reason could be diabetes. Candida thrives in an uncontrolled sugar environment. Candida and sugar, they are best friends. Now take for example, when you leave a bread for a long period of time, you notice there is mold begins to grow on it, and before you know it, it takes over the bread. It is the same thing that happens in the bread that happens in the vagina. Now when there is uncontrolled sugar in your body, this reduces yeast. Candida uses this sugar present in your body to overthrow the good microorganisms in your body. So you know what happens when there's too much sugar in your body? Candida uses this sugar to go and fight Jackie Chan and overpower the good bacteria in your vagina. The last reason could be that it is not a yeast infection after all. Most vaginal infections present in almost the same manner. There's always itching, burning, change in smell, change in color, change in consistency. So you can see that oftentimes you might mistake another infection. You might mistake an STI. You might mistake bacterial vaginitis. You might mistake trichomoniasis for candidiasis. Mama Osato. So you can see this could be reasons why your vaginal infection keeps coming back. And I know that you have said, this auntie wants to finish me because you have found yourself on one of these tables. Now, how can we solve this problem? How can we put an end to the cycle of recurrent vaginal infection? 1. Take antibiotics as prescribed. Mama Osato, stop taking antibiotics for everything. No, take antibiotics as prescribed. That is one way. Second way is stop self-medicating. Mama Osato, stop going to the chemist to go and buy antifungal drugs every time. Seek medical counsel. See a doctor. They in turn will prescribe drugs that you can take to take care of your infection, and they can also help to track your recurrence. And if over time they notice that this drug that have been prescribed isn't working, they can go ahead to prescribe a higher dose or a combination of drugs. A third way you can help yourself is by completing a treatment regimen. Mama Osato, stop taking drugs halfway. Stop taking drugs halfway. Stop taking drugs halfway. How many times did I say it? 3 times. Complete. If they tell you to take drugs for 5 days, for 7 days, for 2 weeks, complete your drug. Complete the medication. So another way we can put an end to recurrent vaginal infection is by wearing breathable undies. Mama Osato, stop wearing pants, tights, bum shorts, skirts all at once. Allow your vagina to breathe. She's a living organism. Allow her to breathe. Stop wearing tights. Stop wearing too tight pants. Wear undies that would allow air at least to enter, get there. Another thing is stop washing your undies by 3 a.m. and wearing them by 5 a.m. to ensure that your undies are dried properly before wearing them. You can adopt the habit of drying your panties under the sunlight, and if you cannot dry it under the sunlight, ensure that it is dried very well before putting it on. There are many people that have ironed their panties, so you can adopt this method. Mama Osato, stop wearing one sanitary product for a long period of time. In the space of 8 hours, at least you should use 2 pads or 2 tampons. Wearing a sanitary product for a long period of time creates a breeding ground for Candida to grow. Another way you can help yourself is by stop using scented products. Stop using all this feminine wash. It is not doing any good. It is not doing you any good. Stop using feminine wash, feminine this, feminine that. Stop. Just stop it. stop it. Stop douching. Stop doing all that, because it is creating an environment that would encourage candidates to thrive. Another way you can help yourself is by using protection. Now, if you do not want to use condoms and all that, you can also use dental dam. But if all this is not an option for you, you and your partner should ensure that you get yourself tested and treated at the same time. Another way could be going to the lab to check your blood sugar level. And if after checking your blood sugar level you find out that you are diabetic, go and see a doctor so they can prescribe drugs to control your blood sugar level. The last but not the least, it is advisable to see a doctor and a proper laboratory investigation be carried out so that the causative agents be known and the proper medication be administered. Mama Osato, I hope I've been able to convince and not confuse you why certain practices could be the reason for your recurrent infection. If you found this helpful, click on the like, share, comment, and subscribe button. Until next time, guys, remain pretty. Bye.